Particularly to Pam McCombe, Dr. Pam McCombe, our research neurologist who's leading our project for what happens to women during pregnancy to MS, and Jeremy Wright for coming up from MSRA to join us today as well. So thank you so much, and our committee is very grateful to share in the news and what's actually happening in the research project. We're really excited to having dedicated our money to a specific project, but particularly this project because the women who are wonderful supporters of ours are all, well, basically everyone has children, so it's very much a perfect project for us to sponsor. And that you were my neurologist doing this was just ironic, amazing, I don't know. So, yeah, perfect. Thank you so much. So thank you for giving us your time, and we'd just love to hear a bit more about the project.
And for many years we were interested in the hormones that occurred in pregnancy that might contribute to the improvement of patients with MS. And quite a lot is known about that. Estrogens and progesterone, the hormones we all know about, are probably very important. And also another hormone that we worked on ages ago called early pregnancy factor. So it very likely is all due to the hormones. But the dose of hormone that would be needed to replicate pregnancy is very high. I worked it out, it's about 8 times the dose of the old serial C contraceptive. So very, very high doses of estrogen would be needed to replicate pregnancy. So it's not really a very practical way of treating people with MS to give them high doses of estrogen, not to mention all the side effects like blood clots. So what this project is to look in very great detail at what happens to the brain and spinal cord and also to the white blood cells during pregnancy and after pregnancy. And obviously we're doing it in animals, not in people. And what we're doing is getting rats. And the first part of the project is not to use the model of MS, but actually to look at pregnant, non-pregnant and postpartum rats to do a kind of preliminary analysis to see whether during pregnancy, to put it in lay terms, whether the brain is tougher and more resistant to damage. So what we're testing is whether maybe during in pregnancy, in the brain there might be growth hormones and things that would make the brain more resistant to damage. So to look at that, what we do is we have the animals, we take out the brain and the spinal cord, we extract the RNA, which is not the DNA, but the DNA when it's been turned into genes. And then we're able to do this project because of modern technology. So with modern technology, it's possible to look at thousands and thousands of genes as they're expressed. And that's what we're doing. We're getting the RNA, we're using a chip called an Affymetrix chip, which literally looks at thousands and thousands of genes to see if those genes are changed in their expression between normal and pregnancy and postpartum. And we've actually largely done that part of the project, and there are genes that are different, surprisingly, just in pregnancy, nothing to do with MS or the white blood cells, but there are genes in your brain and spinal cord that are different in pregnancy, which all women I think would have thought was probably the case because your brain does feel different in pregnancy. But there are different genes, and we're just starting to work through that and see which ones might be relevant to making the brain more resistant to damage during pregnancy. And then the second part of the project is to look at the white blood cells that get into the brain and spinal cord in EAE, which is the animal model of MS. And we already know there will be differences because years ago we looked in a more old-fashioned way at the gene expression in the brain and spinal cord. And we know that the gene expression in the white blood cells changes in a way that would be favourable to MS. And again, presumably that's due to the effects of all the hormones that are circulating during pregnancy. But what we want to do with this modern technology is look at literally thousands of genes and try and drill down at what might be the most important genes that would change in the white blood cells during pregnancy. And obviously, rather than giving huge doses of estrogen, if we said, well, those genes are important, with modern technology it might be possible to just target things that are more specifically beneficial during pregnancy. And so, in essence, that's what we're doing. We're doing it in collaboration with the Queensland Brain Institute, which is the big institute out at St Lucia. And it's a very technologically detailed kind of a project. It has to be done very carefully. We get masses and masses of data out of these chips, literally thousands and thousands of genes. And we use computer programs to make all the comparisons, so that in a kind of a very logical way, the computer tells us which genes are upregulated and which genes are downregulated. And so that's what we're working through at the moment. The next stage of that project would be then to not do objectively, but to get our list and have a go and say, well, maybe it's that one. And that's kind of what you have to do at the next stage of the project. You might have your top 20 genes of interest, and then you actually have to choose one or two and then manipulate those genes and see whether manipulating that gene alone is beneficial in the EAE model of MS. So it's all going well. We're halfway there. We've completed the analysis of the brain and spinal cord not pregnant. We've collected all the white blood cells from the brain and spinal cord of the EAE animals, but we haven't done the full analysis yet. And then we hope later next year to actually start doing some experiments with some of our top 20, top 40 genes and see what's happening. So we hope that it will be very illuminating. And as I said, even though we know that MS is a disease due to the white blood cells, we also suspect that there could be differences in people's own nervous system that might make them more vulnerable or more resistant to damage. And that's something that hasn't really been explored in any great detail because it's quite difficult to do. But one of the new genetic studies just give us a tiny little hint that maybe there are genetic differences in some of the genes in the brain and spinal cord that might make you more resistant to the kind of damage that you would get from white blood cells. So we think it'd be quite exciting if we can say, well, look, those ones that are upregulated in pregnancy might be the clue to what makes your brain tougher and stronger and less vulnerable to damage. So it's all quite technical, but that's how we're doing it, really. Okay.
Fantastic.
Can we ask some questions?